Well, I've always been involved in functional medicine for over 20 years now. So when MedMatrix opened, my husband and I joined right up, and we're some of the first patients signed up for functional medicine here at MedMatrix.
That's incredible. How did you find us?
Well, it's interesting. My husband's a contractor, and he saw the construction going on, so he came in and questioned what business was going to be happening, and the contractor said what it was going to be, so he reached out. He stayed on top of it all, and when they opened, he came in.
That is incredibly cool.
Yeah.
Okay. And what made you interested in functional medicine? Or you said you had been involved in it for a while?
Yeah, I've been, in my early 50s, going through menopause, postmenopausal, high stress at work. Read the Suzanne Summers book on functional medicine and started with hormone replacement back in, I think I was 51 when I started hormone replacement, and has continued on. We continued with supplemental plans with vitamins versus the traditional medicine that the doctors would be recommending, whether it be for hormone replacement or thyroid conditions. So it's been more a natural approach, which I like a lot, because when you go to a traditional doctor, they're prescribing medicine that causes side effects. And so you're not only dealing with what you have for a condition, then you're dealing with all the side effects associated with it also.
And what about pain points that you were experiencing?
Recently, in the past 4 or 5 years, I've neck pain. They discovered that I had crushed on my right side, C1 and C2 in my spine. And I went through the traditional, I had to at the time. I had ablation to my neck. It didn't improve any, I could not turn to my right. My head was almost locked to this position. And the ablation helped a little bit, but not as much. So when I talked to Dr. Rose about it, she recommended PRP and peptides. And since I've done that, I don't have complete rotation like I have on my left side, but it's incredibly much better and less pain since then.
And did you try cortisone shots? The cortisone
Well,
shots?
the ablation is sort of, it's a steroid that they inject.
Okay.
So, yeah.
Interesting. Okay, because I know that's like a common
yes.
Alternative.
That's what they recommend.
Or PRP
yes.
is the alternative.
Yes, PRP is the alternative.
So coming in here with that discovery call, that first discovery call, do you remember anything about it?
It was kind of a refresher because my husband and I belong to Life Extension, so we've been dealing with them over the phone. So it was nice to have a face-to-face and really go through the blood work one-on-one with somebody.
And then what about that first lab draw?
It was much more thorough than what I had had in the past. I had a complete metabolic panel. I have a hypothyroid. They did the thyroid panel also, the lipid panel. It was just so much more complete than what you get when you go to your PCP.
All right. And that in-body?
I've done the in-body. It's very interesting. Kind of keeps you focused.
You've gotten to track it for a while, right?
Yes.
So how has that experience been?
Actually, when I had it done the last time I came in, I had gained muscle mass. Just a little, but when you're in your 70s and you're gaining and not losing, I'll take it.
Yeah. That's awesome.
So Dr. Rose is phenomenal. And what's nice is she also knows my PCP. I kind of get the benefit at both ends, where my PCP, although she's not a functional medicine doctor, she has studied it. Yeah, so when I bring my lab work to her from MedMatrix, she does her own little lab work. But when I bring my lab work to her, can't get over how much more thorough it is. And she said, I can't do this in my practice. So
interesting.
It's been very helpful.
So, and how are you feeling now? You said you had neck pain. Are there any other things that you've noticed?
Well, I've lost weight. I don't have as much inflammation in my body as I had. And I'll be curious, I just had blood work today, and I have a follow-up in a couple of weeks with Dr. Rose. So I'll be curious to see where I'm at with the inflammation. I do have osteoarthritis, so... But body emotion stays emotion, so I try to stay active to prevent more pain, really.
Yeah. So what kind of else do you think there's anything that you would want to, before I get into my closing questions, anything that you would want to talk about, anything that you would want to highlight about your experience here?
Well, I've also done ozone treatment, which while I was sitting in the waiting room, it's like, I've got to go back onto that because it's so good for inflammation.
Yeah.
I'll talk to Dr. Rose about that when I come back in a couple of weeks.
Yeah.
But everybody here, from the front desk to when I have my blood drawn lab work, the owners, everybody has been, and Dr. Rose Rose particularly has been exceptionally knowledgeable. They're very personable. I couldn't ask for a better place to come to be treated.
If you were to explain, these are my closing questions.
Okay.
If you were to explain functional medicine to a friend who doesn't really know much about it, what would you say?
Well, we've been doing this for years because we're a firm believer in supplemental health, supporting with supplements versus over-the-counter or prescription drugs. We do have information from Life Extension and that we pulled from here, brochures that we have at home, that we share with our friends about the benefits of vitamin D, PRPs and peptides. We just had a friend that we strongly recommended to come in. It's just a much healthier approach overall.
And if somebody was on the fence, what would you say to them?
If they know me, they've seen firsthand what a transition it can be for you to take the supplements, to believe in what Matrix has to offer. I would say come with me. I'd have them come along if they had real doubts. But we always, my husband and I both highly recommend Matrix with any of our friends.